everybody is not going to have a heart attack or problems when they have a root canal. Okay, I don't want to say that. But I will say many do. And at this point in time, it's impossible to predict which ones are going to cause the problem.
All right, guys, welcome to Do Not Take the Pill, a place where we aim to provide hope for true healing from chronic suffering by talking to experts like who we have today, Dr. Levy, and how to treat the system, not just symptoms. I'm Jess, and today we're going to discuss a very stealthy infection that can impact your well-being from many different fronts. I say stealthy because it's undetected by doctors, it seems, and oftentimes by us patients ourselves. Thought to be a direct correlation with heart disease, breast cancer, and many, many, many more modern day illnesses. We're going to explore the hidden epidemics in our mouths. So if you have metal in your mouth, if you've endured a root canal procedure, or really if you just have teeth, this episode's for you, so listen up. Our guest today is Dr. Levy, Dr. Thomas Levy. He is a board-certified cardiologist and, interestingly to me, a bar-certified attorney. You've written multiple books, one of which we'll discuss today. It's called The Hidden Epidemic. So thank you, Dr. Levy, for being with us today. We just appreciate your time.
Happy to be here.
So one thing I wanted to ask was, again, we talked about cardiologists, bar-certified attorney, yet we're sitting here having a discussion around healthy gums or unhealthy gums. So can you tell us about your journey? What got you to trying to get the word out about this hidden epidemic in our mouths?
Well, back in the early 1990s, I was a regular mainstream cardiologist, plying my trade, doing my angiograms, etc. And I encountered a fellow by the name of Dr. Hal Huggins in Colorado Springs, Colorado. Dr. Hal Huggins, for those who aren't familiar with the name, is really the first biological dentist in the world, in my opinion. He had a clinic where people came in from around the world, spent 2 weeks, would get mercury out, root canals out, other infected teeth, and go on a program of a specific diet and specific supplementation. And I didn't think much of it until he invited me to see his clinic one day. And I happened to see this sickly little old lady in a wheelchair going in to get dental work. And I said, poor thing, she's not going to do well. I mean, she had extractions and everything else under the sun. And over the course of about 3 hours, she came out looking bright-eyed and energetic and wanted to have her caregiver take her out for a big restaurant meal that night on the other half of her mouth that hadn't been extracted. And I said, something doesn't compute here. And I said, Hal, Dr. Huggins, Hal, what's going on? He said, well, it's the IV. I said, okay, I get it. It's an IV. I'm familiar with IVs. He said, well, it's what's in it. I said, okay, what's in it, Hal? He said, 50 grams of vitamin C. And that just completely took me by surprise. But I immediately knew, at least in my mind and my heart, I immediately knew that this was probably the most significant thing I'd ever heard in my life. And that began my affiliation, working as a consultant at Dr. Huggins' clinic, my research on vitamin C, and that was in probably 94. So my first books came out in about 1999. So it took quite a few years of percolating and research before I decided I need to put it in books. And since then, things have evolved. Well, I mean, we have 25 more years worth of research in the literature. And as it turns out, it all pretty much backs up what Dr. Huggins was doing. It's just that we have now even more definitive studies that I'm sure Dr. Huggins, who passed away about 5 years ago, would have loved to have known about.
I was reading in your book that you called that a providential meeting, right? When you're ready, the teacher will arrive. And I can't remember.
When the student is ready, the teacher will appear. And let me tell you, for me, for my life, there's a lot of truth in it. So I'm not going to tell everybody that that's how their life is going to evolve or turn out. But basically, I get to a certain point in time where I'm asking myself a lot of questions about lots of different things. And then lo and behold, you find yourself in a situation where suddenly you start getting answers.
Yeah. Well, my hope for this podcast is that it hits somebody today who's ready to hear it and ready to start asking some hard questions about correlation, causation. One thing you did mention was biological dentistry, and that might be an unfamiliar term. So, what differentiates that from traditional dentistry?
Actually, and it's the difference between being a tooth mechanic and a healthcare practitioner who strives to understand the underlying physiology in teeth, the ways the rest of the body impacts the teeth. I mean, so many dentists, they think the mouth is their domain and nothing else touches upon it. But in fact, I think as we'll see as we talk a little bit more, there's nothing more interrelated and integrated than what's going on in your mouth and the health or disease of the rest of your body.
Now, I want to just interject here because quite a few years ago, we lost my grandma, and something always stuck out in my mind. There was a doctor that she had a hip replacement surgery done, multiple years prior to her passing. And her doctor said she has an infection in that hip. We believe that infection started in her mouth. And I don't know why that's always stuck with me. And here talking to you kind of brings it full circle. And so we're going to talk about multiple different conditions, but just the fact that issue that started with her gums, I would assume, moved down and traveled to a assumed healed hip to cause such havoc blew my mind at the time. And I'd kind of shelved that thought, and just talking to you brings that all to light about how common and how stealthy these infections actually are. So
Yes.
With that, what is the prevalence? I mean, maybe something that's not that severe or is, but what is the prevalence of just gum disease? And periodontitis is gum disease.
Enormous.
Okay.
There are very few adults with completely normal gums. Gum disease, inflammation of the gums, and then gums is gingivitis, the upper part. That as it goes down the gum line alongside the tooth, that's the periodontium, the periodontal tissue. So it's basically gum disease that evolves more advanced, and you either just have gum disease or it advances to the point where you reach the tip of the tooth and then you seed growth of pathogens and you develop what's known as asymptomatic, pain-free abscesses. But just like you might imagine, nothing is healthy about an abscess in your body, and whether it's painful to you or not, it can be causing, and for the most part does cause, just about every disease known to man. Now, the studies have been done, correlation, association. Medicine abhors and researchers abhors saying factor A causes factor B.
Mm-hmm.
Even when it's become overwhelmingly obvious. There's a lot of different reasons for that. I won't go into that right now. But let me tell you, forget about that. Chronic infected gums and periodontitis, if they don't primarily cause, they feed every disease in your body, because every disease in your body is a variation of a variety of different areas of oxidative stress. To the degree to which biomolecules, RNA, DNA, protein, enzymes are oxidized or in an electron depleted state, they become inactivated, they don't work, and that is disease. The disease is how many oxidized biomolecules do I have in what locations? Because all toxins are pro-oxidant. They oxidize, they take, and that's why they're toxic. They're toxic because they oxidize. That's what toxicity is. And as it turns out, pathogens are the major overwhelming source of daily toxins inside just about everybody's body. Unless they live next to some sort of a fertilizer plant and have some sort of crazy outside environmental exposure to a high dose toxin. when they get sick, you don't need to look at the outside, you need to look at the inside. And
Hmm.
the answer there is nearly always the mouth. As I noted in the book Hidden Epidemic, the subtitle being Silent Oral Infections Cause Most Heart Attacks and Breast Cancers. And I wanted to pick on those two because if you can deal with heart disease and deal with breast cancer, you're dealing with what kills a majority of people on the planet. If you add breast cancer to heart disease, that's well over 50% of the population, the reason that they die. So how important is that? And so in the course of this, in the front of the book, the front area, you see an image of the teeth, which is the typical picture that is taken by dentists. It's called the Panorex, panoramic view of the teeth. And it gets all the teeth in there, but it misses so much. Okay. It probably misses well over 50% of infected teeth.
So you're saying that if someone goes to the dentist tomorrow, traditional dentist, they will have that exact picture taken and up to 50% of the issues will be missed?
Yeah, 50% of the infected teeth, which are the most important issues, absolutely. Uh, and and the demonstration on that cover of the book is that you see a tooth on the Panorex that you can't really make out any problem at all, and they have a little circle around it going down to the picture you get with this special cone beam examination of the mouth, a 3D X-ray, basically, a 3D X-ray. And then it's very obvious that that tooth is not only severely infected, it has a large abscess, and it was eroding through the wall of the sinus.
Now, the
Okay.
cone beam X-ray, is that something that is in most traditional dentist offices?
Increasingly so, yes. I mean, if straight out of the gate you want to make sure that you find a dentist that has, well, first thing you do is if you're is if you find a dentist that fills the bill, you call the office, and before you make an appointment, you ask if they have that. Okay.
Mm-hmm.
Uh, Most dentists who do implants will have it because it's almost malpracticable not to completely map out the anatomy as accurately as possible of the jawbone and where you're going to do an implant. So this gives you the best 3D image of the bone that they're going into. Endodontists who do lots of root canals, and I don't advocate root canals, but endodontists have a lot, and increasingly so large dental practices. So it's probably going to depend on the size of the dental practice. You really find someone who does a large volume, lots of dentists in the office, more than likely they'll have the machine as well. I mean, it was pretty rare 10 years ago, not so rare now.
We always talk about advocating for ourselves when we walk into partner with our doctors, right? And it's no different to our listeners out there. And just a call to myself of advocating for ourselves. Is this a scan we've had? And how do we find a dentist who, whether traditional or biological, how do we ensure that we get the scan done? Because it does sound like it really differentiates the holistic view of our mouths to see whether you talked about these asymptomatic abscesses, right? So I could be walking around right now and truly I have no pain in my teeth. Yeah, I could have a stealthy abscess that won't get picked up on the normal scans that they're doing day to day in the dentist's office.
Right. And I mean, and that's pretty much the book, even with young ladies like yourself, frequently diseases like breast cancer, but other things as well. Uh, if you're not proactive in trying to keep your health well, your first symptom is going to be the lump. Okay,
Mm-hmm.
or in the case of the and with the ladies as well as the men, the first thing is going to be the chest pain or that sort of thing. Those things do not happen for no reason at all. I can't tell you the number of cardiologists who think when a 50-year-old man walks into the office, has a normal cholesterol, is eating a fabulous diet, doing everything right, good blood work, and has chest pain, and they find out there's coronary artery disease, the cardiologist thinks, what an unlucky son of a gun.
Hmm.
but it's got nothing to do with luck. Well, it does have, if luck involves what dentist you have and whether that dentist likes doing root canals, which are uniformly always infected teeth, okay? You have the asymptomatic infected root canal, and you have the asymptomatic tooth that's never been treated in any way at all, and they're both highly toxic. But you don't know you have it until you look for it. I mean, I go on in the book, and it's my recommendation that at any age when you have your first evaluation, especially as an adult, let's say you're an athlete and you're getting your sports examination, physical examination, and they do the CBC and the biochem panel and routine blood work, this should be a routine test as well. And
the cone
let's
beam
say
scam,
the cone beam, and you're 25 years old and it's normal. Great. Now you have a baseline.
Yeah.
So let's say you're 35 years old and you start developing a problem, your blood sugar goes up, you start getting high blood pressure, you develop chest discomfort, then you redo the test and you'll very frequently find asymptomatically infected teeth. And most people, when they think about an abscess, including dentists, they think of a horrible, painful tooth. That is the tiniest minority of abscesses because it develops rapidly. What I'm talking about here develops slowly, so no part of the tooth is put on stretch. The stretch is what causes the acute development of the pain. So when you see these infected teeth, and you see them on a significant majority of adults across the board, you're looking at something that is pain-free, and I mean completely pain-free. Chew on it, do anything you want, well over 95% of the time. So it truly is a stealth killer.
So tell me, how does that infection that our brains haven't even triggered a pain response to causing such havoc in our bodies? Is that through chewing and a release of toxicity into our lymph? Is that through sinuses? Explain kind of baseline so our listeners and myself can understand how is that impacting our health?
As you just said, the single infected tooth, when you chew on it, you effectively deliver pathogens and toxins into the lymph, as you said, and also into the draining venous blood supply. And you do it as effectively as if you took a syringe full of that and injected it right into the blood. I mean, it's a horribly well-designed system of disease causation. Now, when you're looking at heart disease, let me go off into an aside on this. Heart disease, and we're talking coronary artery disease, where you get the blockages that eventually block off completely and cause heart attacks. That's the part of heart disease I'm addressing now. That only occurs when the blood vessel becomes chronically infected. Okay, and when it becomes chronically infected, you use up the vitamin C, then you develop inflammation, and then the immune system comes in to try to deal with that inflammation, but it can't deal with the inflammation because what's causing the inflammation is a steady, nonstop release of new toxins and new pathogens on a daily basis. Dr. Huggins told me many years ago, one of the most incredible statements I've ever heard in my life, is he was a little frustrated with me one day when we were talking about these things. He said, Tom, said, you need to understand you can't dry off while you're still in the shower. Okay, so it's just, I'm not saying you can't help a lot by treating something or this, but you're never going to be successful until you identify and stop what's triggering and promoting the disease on a 24/7 daily basis. So when you chew on this tooth, you release into the venous blood, very low pressure, these pathogens. So they're low pressure, they just stay in the blood. Go down to the system, to the pulmonary artery, come around, everything's low pressure, come to the left atrium, everything's low pressure, then into the left ventricle, and boom, you go from low pressure to high pressure. And just like a jackhammer, you push those pathogens, physically push those pathogens and seed the arterial wall, and your coronary artery gets 25%. of your cardiac output. So it's the area, even though it's very remote from your mouth, it's the area that gets hit hardest. But there's evidence that these pathogens go everywhere. They're part of cerebral aneurysms. They're part of all gastrointestinal, stomach, and cancers. Okay. We've even seen where they get seeded into the neuronal tissue of Alzheimer's patients. They literally play a role in just about everything, but nobody's looking for them. So that's why this is still a transitional point, in my opinion, in our evolution of understanding medicine and chronic disease. Is we first need to appreciate why these diseases are occurring before we're going to have a clue as to how to deal with them.
Yeah. Again, let's treat the system, not the symptoms.
Oh, and
right?
let me add this for those who think this might be a little out in left field. In Circulation, which is the most significant mainstream cardiology journal, and why cardiologists don't know this, I can only think that either they don't read their own journals or they don't apply what they read. In 2006, Dr. Ott, O-T-T, did coronary atherectomies. That's literally a roto-rooter. They do an angiogram and then put a special device in and scrape out the obstructing coronary plaque. He did this in 38 coronary artery disease patients. He analyzed the plaque, and they had 50 or more different oral pathogens and periodontal pathogens in this plaque material. And he had it in 38 out of 38 coronary artery disease patients.
100%.
Well, pretty close to 100%. Yeah, pretty close. And this is what we're dealing with, and it's not present in a normal coronary artery. A normal coronary artery should be sterile. It shouldn't be filled with pathogens coming from your mouth, but that's exactly what the data says. But even in the face of something like that, they still like to say, well, there's an association, there's a correlation. No, it's cause and effect. Another study years later in people who had acute heart attacks, they went in and they scraped out again the clot that was causing the heart attack. And inside that clot, they had 16-fold, 1,600% more periodontal pathogens than in the blood. Now, what is a blood clot that's causing a heart attack doing, containing a huge concentration of periodontal pathogens? Okay, not a coincidence, not a casual association, cause and effect.
I really encourage just listening to you say that for people to go and download. This is a free download, correct? The Hidden Epidemic.
Yeah. Mm-hmm.
And we'll put that in our show notes as well. But I really encourage people to read through this because it is so intriguing. And I just would say like intuitive once you start thinking about it. I do want to take a little bit of a shift because we're talking about the stealthy ones. We're talking about the abscesses that we could be walking around with and completely have no clue exist. But there's the whole other side of listeners who have had root canals. It's not an uncommon procedure. I dare say the majority of people I know who have experienced a root canal or some other I talk about metal in your mouth. I'm not really sure. You could go in a little bit deeper on that with just fillings. So when we're talking about the abscesses that we know have caused pain and they've been removed and taken care of, we don't deal with them now from a pain standpoint because they've been quote unquote fixed. Are those still assaulting our health?
Well, 100% of root canals, or at least greater than 5,000 in a row that were sampled by Dr. Huggins and worked with by Dr. Boyd Haley at the University of Kentucky, are infected. The only thing canal procedure does is it debulks the infection. It pulls a lot of the infection out, okay, just as if you lance an abscess, for example. And then they scrape out the pulp in the middle of the tooth. And they basically effectively snip all the nerves leading to that area so that even though it's still infected, you no longer feel pain. I mean, ultimately, we're just creatures of discomfort or pain, seeking discomfort or pain relief. That's what brings us to the doctor is we're uncomfortable, we're in pain, get us out of pain. Well, when it comes to pain in a tooth, The root canal procedure is highly effective in relieving pain.
Because
not
it's
in
deadening
dealing,
the nerves.
right, not in dealing with the pathology of the tooth, because once the tooth becomes infected, that part of the tooth is dead. Even though you might have discomfort in the tooth and the jawbone where it goes into it, the upper part of the tooth has basically been taxidermized. I mean, it no longer has a functioning pulp with the nerves and the connective tissue and the blood supply. All of that has been cored out, and you just have a physical tooth in that regard. Now, with regard to root canals in general, we have a lot of data showing their direct correlation with heart disease. Not surprising, since I just told you about all coronary artery disease, diseased coronary arteries having chronic pathogen colonization coming from the mouth, and the same pathogens that you find in gum disease and in infected root canals and other infected teeth. But everybody is not going to have a heart attack or problems when they have a root canal. Okay, I don't want to say that. But I will say many do. And at this point in time, it's impossible to predict which ones are going to cause the problem. So when somebody says, is this root canal going to make me sick? I can only say it might make you sick. Okay. I can't guarantee that it won't. I can't guarantee that it will, because then it depends on other things as well in your body, such as whether or not you have a estrogen or testosterone deficiency, whether you're low on thyroid hormone. All these things strongly impact whether focal infections stay focal or spread. Okay, they all relate. And the other thing too is people want to know, oh well, what should I do? I have 7 amalgams and I have 2 root canals or something like that. Well, you got to remember.
And when you say amalgam, you mean the amalgam fillings, correct?
Right, the mercury amalgam fillings.
The mercury amalgam fillings.
Now, those are nasty, no doubt about it. But in my observation and clinical experience, 7 amalgam fillings are never going to damage you as much as 1 or 2 root canals. The toxicity of the infected tooth is vastly higher than the toxicity of the amount of mercury that they put in the filling. Obviously, you don't want either. But so somebody says, well, what should I do? But I don't have that much money. I said, well, if you don't have that much money, get the root canals and the other infected teeth out first and leave the amalgams alone. Because, people don't like the dentist. People don't have a lot of money. Dentistry, like we're talking about, is expensive. I acknowledge that. I mean, I didn't set up the system, and I can't argue against any dentist that needs to charge X amount to run a very huge practice and get all this done and have an appropriate profit margin. But the bottom line is, this type of dental treatment is expensive. Okay, so it's a good idea up front to figure out in your particular situation what's causing your problems most. The other thing is, once you've, let's say, for example, diagnosed with the 3D cone beam, all the infected teeth, the root canals, those get extracted, cleaned out. And as far as we can tell, you now have, at least infection-wise, a pristine mouth. Very important as well to find a dentist who works with ozone so they can inject ozone into the tonsils, because all the tonsils basically drain these infected teeth and they become infected themselves, even though they look normal. There's a lot of data out there. I probably don't have time to go into it, just to show that when you have root canals and other infected teeth, the tonsil along that same line becomes grossly infected, but not like childhood tonsillitis. Okay, those are very grossly, obviously infected tonsils. Somebody opens their mouth, they're huge, they're pitted, there's white spots all over them. That's not what we're talking about. We're talking about tonsils that look normal, but are severely and chronically infected. And short of a tonsillectomy, which is a horrible procedure for an adult to go through, I guarantee you, you can resolve them most of the time quite nicely with intratonsillar injections, of the right concentration of ozone gas.
I would like to just point out for those of you listening who might not be familiar with ozone, we've done a couple of shows on ozone. Just do yourself a little research and find that is an accessible treatment. But what I'm really hearing from this was if I had a root canal and I'm sitting here thinking, hey, I could still have an abscess beyond that root canal, beyond that procedure, which in my mind, I thought healed me, right? I no longer feel the pain. I chew fine.
Right.
I need to go get a cone beam scan. Is that what I should be saying? If I'm a listener right now thinking through this of where to start, I need to start with a cone beam scan and cone beam scan,
Yes.
and that will reveal what's going on.
Well, I like to put it this way. When somebody says, should I get this root canal taken out? I say, all I can tell you is if your primary, and I'm not being sarcastic, don't get me wrong. I said, if your primary concern is not whether you have the tooth and whether it hurts, but your primary concern is the quality of your long-term health, you should get it extracted. Now, having said that, you'll find some people in their 80s and 90s and they have root canals and they obviously got along just fine. So I'm not saying having a root canal assures you of catastrophic consequences on your health. Well, yes. Now, so having said that, I said all root canals are infected, but some are well contained because the procedure was done in a much more advanced and expert fashion. So while I never again want to emphasize having a root canal done, if you have a tooth and you don't want to get extracted and you don't want to do anything else with it, and you decide that you need to make it stop hurting and have a root canal done, by all means, get a high volume endodontist to do it, because the quality of the procedure by somebody who does 25 root canals a week rather than 2 or 3, because a lot of general dentists, they just like to get their little piece of the pie and they'll do a root canal and it's just not done that well. Okay, so there is a lot of expertise involved in doing the procedure technically well and making it much less likely, but not assuredly, of having the infection, which is always there, stay place versus increase and disseminate.
Well, that provides hope. And that's one of my main questions is for, like I had stated it when we first opened the show, everyone has teeth, right? And we all live in a world where the food is not perfect.
Who listening to this program can go give a really clear explanation to their doctor or dentist what they want and what they're talking about? The thing to do is to let the book speak for you. Okay,
Yeah.
is you say, doctor, dentist, doctor, I'm concerned about this. These are the things I'm talking about. And hey, somewhere along the line, and without sounding condescending, the doctors and the dentists need to pick their game up and not just think that their education ended when they graduated from dental school or med school. Okay, and that's pretty much the case because, like I said, a lot of the things I'm talking about is in their literature, but they don't assimilate the literature into translations, into transformations of how they practice.
Yep.
So it's going to be a struggle. Okay, so whoever wants to do what's best for their health, it's going to be a struggle. If you want to just be passive, and just say, okay, doctor, dentist, do what you want with me. I trust you. Well, that might be easier, but I sincerely doubt that it's in your best health interest to take that attitude. You really have to make your own research, going into stuff like we're talking about today, finding dentists and physicians of a like mind, the biological dentist and the integrative physician. And even again, those are general terms. So you still have to see and find, I have a dentist I can talk to and answer my questions. I have a physician I can talk to and answer my questions, and feel like they're informed on what you're talking about, because this is all evolutionary at this point. This isn't a body of knowledge that's possessed by a large number of physicians and dentists right now. An increasing number, but not a large number yet.
So tell me this, the basic call to action is A, there's hope. B, walk beside your dentist, your integrative health practitioner, advocate for yourself. Listeners, we all have an intuitive feel on certain things. If this intuitively resonates with you, or if someone you know or love has a heart condition, has breast cancer, send this episode, send the book. It's a free download. But I want to add a third component, and that is just the component of preventative care. So right now, what can somebody start today in their dental regimen that will really set them up for best case scenario with prevention of these issues?
Well, prevention needs to start from the perspective of I already resolved my identifiable infections and toxicity. So if you've done the 3-beam and you have infected teeth and they're out and you're doing everything right there, then you need to look at gum care on a regular basis because it all starts with the gums. With the rarest of exceptions like severe decay, you don't spontaneously get infected teeth. You get infected teeth because the gums become infected and they eventually evolve into the teeth being infected. So you need good gum care, which, and again, is covered in the book, is involved with water picking, water with a little bit of hydrogen peroxide added to it. This gives a nice non-traumatic cleaning, deep cleaning to the teeth and the gums every day. And with the peroxide, you destroy any pathogens that are beginning to infect the areas. Matter of fact, this is so effective that if you see people with advanced periodontal disease where the gums between their teeth are flatlined, they no longer have that nice little peak. You can actually, in many people, regrow new peaks of gum tissue in a few weeks when you start doing this type of treatment, along with, of course, healthy supplementation. Now, the other thing that's is keeping the other pathogen sources down in your mouth, which means, and this is covered in another book, but a lot of people have severely chronically infected surfaces of their tongues. The tongue should be scraped on a regular basis, okay? And chronic pathogen colonization inside the nose and throat and upper airways. And this is addressed with something else we talk about, hydrogen peroxide nebulization. You do those things and you keep the pathogen, the available pathogen count down. You resolve the issue of any infected teeth you already have, take care of your gums, and then make sure at least once or twice after all of this has been done that if you have tonsils, they get injected with ozone because the tonsils will stay asymptomatically infected indefinitely after the infected teeth are gone because they're wimpy tissue. They just don't resolve well. Okay. They're used to dealing with low grade pathogen exposures and they deal with that fine. When you have an infected tooth and it just keeps on bombarding the tonsil on a daily basis, 24/7, it will get infected and stay infected. And in and of itself be a major source of problems with heart attacks in the same way as an infected tooth.
Now, I want to have you back on a future episode talking about the nebulizer, because that is just, for those of you listening, there's another book out there that he wrote all on using a nebulizer with peroxide to help face the world of viruses and many more, right? Gut biome health. I kind of
right. And including our current pandemic. Yes.
Yes. What is the title of that book?
Rapid Virus Recovery.
Rapid virus recovery. So we'd love to have you back on to talk about rapid virus recovery. But what I'm hearing people can do today is go on Amazon or to your local store, I assume. Where can you actually acquire a water pick? That might be new to some of our listeners out there.
Gosh, Yahoo, Amazon, eBay, the local drugstore, Walmart, Target, they're all over the place.
You name it. Put in water pick, get a tongue scraper. All right. Well, Dr. Levy, what is the best way to find you for our listeners to contact you or to just get more information?
Well, my website is peakenergy.com. And I have my email and I give it freely, but people need to understand I don't do consults. Okay. And you're welcome to ask a question. If it's something I can give you information on, fine, or lead you to the information. But, I'm not going to be able to help you if you write me a page long thing about every blood test your mother, father, brother, or sister had. Can't do a consult. And the email is my initials and my last name, T.E. Levy, MD, at yahoo.com.
All right. And just for a reminder, that is why we walk next to an integrative practitioner, right? So you're there as a reference, but really we're just trying to find someone who is going to treat our system, our whole body, not just our systems. So thank you so much.
All right.
Not just our symptoms. Man, I'm getting my words mixed up. Thank you so much, Dr. Levy, for spending some time with us today and just all of your expertise. And from the bottom of my heart, thank you for giving a free book. I thought that resource was just, like I said, it was fascinating to me. It clicked from an intuitive level. And I think it provides a lot of hope, right? We have a major issue going on, whether it's an epidemic or a pandemic with just our health as a society. And it just gives a starting point and everyone can access it. And I think that's a beautiful thing.
Well, I got to say this, altruism pays. It wasn't the intent of giving the book away. The book, I want the information to get out there. I don't want all this information I've accumulated over my professional life just to go to a few people that pick the right resource and go. I wanted to get to everybody. So give the book away. Well, in the course of doing that, it uplifts the profile of the book, and more books are selling on Amazon than ever before as well. So it's interesting how things turn out. A lot of people, once they see the download, they want the physical book as well.
That's what I was just going to say. You can download it. It's a PDF. Or in this case, if you want a hard copy, go to Amazon.com and look up. It's called The Hidden Epidemic, just uncovering some really interesting connections from your mouth.
Right.
So thank you again, Dr. Levy. Hey, guys out there, if you love this podcast, share it with your friends and family or those who you think would benefit from hearing about proactive ways to just ensure healthy gums, a healthy mouth. As always, leave comments regarding your journey. We'd just love to hear about your struggles, your successes in dealing with this issue. Also hit subscribe on wherever you listen to this podcast. So we'll talk with you next time on Don't Take the Pill. Thank you very much.
Thank you, Jessica.